Deputy Commissioner Mal Lanyon, Deputy Commissioner of the Metropolitan Field Operations in the New South Wales Police. For the past week and a half since Sydney entered into a lockdown, New South Wales Police have had a very visible presence right across the metropolitan area, ensuring compliance with the public health orders. Our work has been solely dedicated on ensuring community safety. We have moved across the metropolitan area in order to police areas of concern as they've been raised by health, and we've made sure that we're very visible to educate the community about how to comply with those orders. Clearly, we are still having members of the community who will not comply. Where we haven't been able to achieve compliance, we have enforced those health orders. And whilst obviously we will continue to wish to get compliance, we will enforce as necessary. We've heard very clearly and very loudly the words of our Premier and Dr. Chant in terms of the emerging areas of concern in southwestern Sydney. As a result of those concerns, come 7 a.m. tomorrow morning, we will commence a dedicated police operation with at least 100 more police officers entering the southwest metropolitan area to ensure compliance with the public health orders. Those police will be drawn from a range of areas and will be a very visible presence. They will include the Traffic and Highway Patrol, the Police Transport and Safety Command, and our mounted police, as well as a number of other specialist areas. As I've said, what we are looking for are members of the community to comply. We have worked very hard with members of the community and will continue to do so. But now is the time to make sure that we stop this virus. Now is the time that New South Wales Police will ensure that we get ahead of this virus, and hence the reason for a dedicated police operation. The virus has shown very clearly that it doesn't discriminate, and nor does the New South Wales Police. That's why we're targeting the southwest metropolitan area as of tomorrow, as we have done where other areas of concerns have been identified. I'll hand over now to Assistant Commissioner Tony Cook, who is the Commander of South West Metropolitan Region, who will speak about particular activities that they've undertaken in their region, and they're more than happy to take questions. Thank you.
Good afternoon. Thank you, Deputy. As Mr Lanyon has said, from tomorrow morning at 7 o'clock I will deploy an additional more than 100 police across southwest metropolitan Sydney, seeking to support our community to continue to comply with the public health orders as they've been written. Compliance is about us getting ahead of the virus. It's about supporting our communities to ensure that those of us who have businesses, who have loved ones, can see them again, that our businesses function, that our community opens up, and that we can move forward. Health very clearly have said to us we have a difficulty in southwest Sydney. This is all about helping our community to comply. Where we do not get that compliance, we will enforce. Be very clear. We are continuing this work in a high visibility sense. We are also continuing it with our community leaders. Our multicultural liaison officers have been deployed for weeks now across the community, sending the message. We have paraphernalia in 56 languages distributed through communities to allow them to understand, to make sure that we all understand, to make sure that we know how to comply. My message is very clear. This is about us working together to comply with these orders and about police supporting. Where we don't get that compliance, however, we will enforce. Thank you very much.
The Premier and Dr. Chant today made it very clear that the big problem with transmission in that area is families visiting other family members in their own homes. How do you police that?
The idea, look, if you don't need to go out, stay at home. Those are the stay-at-home orders. The problems that we have, that people are going out when they don't need to, they are coming back to the home and infecting their families. That is what we've seen, and that is what the health advice is. Look, I would say to people, just make this decision. Do you really need to do this? And if you don't go out. Stay at home. Don't bring the risk of the virus back into your family to infect your own loved ones.
Are you finding that the people who are spreading the virus and infecting family members, when they are found, were they not aware of the rules, or were they knowingly defying them? What's happening there?
Look, I'm quite confident now that people know what the virus is. We've been at this 18 months now. We know what compliance is. We are making it abundantly clear. We now need to really look at ourselves personally and ask ourselves, are we doing the right thing? In large part, people are trying. There are some who are not. Where people have difficulty, there is information available. I am continuing to meet with community leaders, and in fact we'll do that again later this afternoon. So we are getting information out there. There is information available. So please comply. If you can't get the information, ring your community members, work with your community. All of the community leaders are out there and are working very hard, as are our police and our multicultural liaison officers. So there is plenty of information out there.
Dr. Chant mentioned today one of the issues is shopping, that people are actually browsing when they're shopping. Can you patrol the big shopping centres of the region? If people are just wandering around aimlessly, can you caution them or give
We
advice?
will absolutely be doing that, and the question will be asked is what's your reasonable excuse for being here? You don't need that pair of shoes today.
How long do you anticipate these extra police being out in the southwest community?
We'll run this operation until until health advises that we no longer need to do it.
Do you think police have been at all heavy-handed in any instance of complying with rules?
Not at all. Look, we are seeking support from the community to continue to get us through this. This is what it's been like from the beginning. We've been at it for 18 months. We need people to take responsibility for themselves and comply.
Sorry, Assistant Commissioner, just to clarify that earlier point, if people are going out wandering around looking at shoes, that is something you would pull them up on?
They need a reasonable excuse to be out there, and people need to ask themselves the question, do I need to do it? And most often the answer can be no.
We've had 2 previous days with 35 cases in the South Harbour. We've had 38 today. Do the extra numbers warrant sort of the escalation of enforcement in that region?
Look, we've been continuing our compliance activity for some time now. Yes, this is necessary. The health advice is this is a risk, and this is our response, and this is what we will do to get in front of the virus.
The majority of the fines that have been issued in the last 24 hours are for mask offences. Have you noticed in your region not wearing masks is a big issue?
Look, compliance actually across the 3 metropolitan regions is at fairly similar levels, the actual issue of penalties. What I can tell you is that our compliance, inspection and monitoring numbers have raised significantly. So mostly mask wearing, yes. People need also to ask themselves though, do they need to be out and about? Is their excuse reasonable? And can they wait?
When finding people who are in breach of the rules, will police basically show discretion on whether someone may have not been informed in their language or may not have had access to resources when they're deciding whether to issue an infringement notice?
The police on the street will make an assessment, as they have done all the way along, and I would absolutely say that we have been very fair in our operations. But the reality is we need to comply. Where we need to enforce the public health order, we will. Thank you.
Good luck.
Thank you.